Hi, today we will have a ScentTech Talks series. I will interview David Tomasi. But before that, I will explain what is ScentTech Talks. ScentTech Talks is a podcast within project Scent Recorder for emotional well-being. This project is supported by Latvia via Latvian Investment Development Agency and Norway via Norway Grants. And within that project, we aim to build a scent recorder or device that could capture, store, and release scent. So this is design concept from our previous studies. Now we'll start the conversation with David. Hi, David.
Hello.
Can you just shortly introduce yourself?
Sure. Well, thank you for having me here, first of all. I am a psychologist, researcher, neuroscientist. I work here in Vermont in the United States, although I'm originally from South Tyrol, the autonomous entity split between Italy and Austria, the Alpine mountain range in Europe. Most of my research focuses on neuroscience and psychology, and both in my teaching academic activity, as well as my clinical practice. When I see patients, I like to be holistically informed about the newest research, and more specifically regarding olfaction. One of the most current research that my team and I have published were on virtual reality, more specifically olfactory virtual reality. And a lot of that is predicated upon the need of focusing on things that go beyond either pharmacological intervention for psychiatry and standard psychotherapy for two main reasons. One, that psychotherapy is only useful if the population attends it. If nobody wants to attend a psychological session, evaluation, or psychotherapeutic session, then you don't have the chance to help people. And the second factor, more regarding other modalities, medications, or exercise. In both cases, we are dealing with something that is predicated upon biology on one side and neuroscience on the other side. But yeah, we might have issues either monitoring the effects or having the patient actually follow up with it. So we wanted to focus on something that was less invasive and also felt more real. That's in short what I've been doing in the last, I would say, 10 years.
Thank you very much, David. And maybe very shortly, right? What scientists knows about scent so far?
What science knows about scent? Yes, the most important thing in my field is the connection between cognition, emotion, behavior, and smelling. That's the most important thing in my field, of course. Now, in terms of the neuroanatomical factors, what we know from science, we know that the way the scientific understanding of scent is predicated upon brain activity. And so how do we smell things in our body? Well, we have the way the body understands smell through the epithelium is the first gate in our nose, in our nostrils, at least in human beings. And then you have a sequence of processes that involve other brain areas, such as the anterior olfactory nucleus, the olfactory bulb, the mitral cell, and lateral olfactory stria. And so all this involve standard neurological procedures. So there is a depotentiation, there is an action potential, there's action function, there's plenty of receptors, millions of receptors, in fact, in the epithelium. But the most important thing, I would say, despite the fact that these are all very, very important, without those, the rest cannot function, is the activation between the limbic system and the cortical factor. So between what we would understand as, how can I say, as in a primitive sense, as any other animal, our inner sense. Some will even refer to the limbic system part as the animalesque part or the instinctual part of the brain. It's kind of a misnomer. It's a bit superficial to see it that way, but it makes sense because it's a less refined version of understanding in comparison to the cortex. So what are the links between the limbic system and the cortex from the perspective of smell, from the perspective of olfaction? I would say the olfactory amygdala, the periamygdaloid cortex, and the amygdala is two almond-shaped glands, one on each side of the brain, that are responsible for the fight and flight response mechanism. They're related to stress, they're related to self-esteem, self-image, and they communicate with other elements around it, the piriform cortex, the entorhinal cortex, and they modulate emotional response. So in simple terms, they're kind of the seat of emotional cognition, if not emotional intelligence. So they allow us to sense something before we rationalize it. Now, these are not independent, of course. They're still connected with the rest of the cortex, with the mellodorsal thalamic nucleus. But this is important because olfaction, for the most part, skips the thalamus. And so it doesn't really have to be encoded the same way as other senses are. And so this is beneficial, especially in my field with neuroscience, psychiatry, psychology, because some people might understand what they need to do. In other words, how they need to change their thought process. But just because you understand it here, you don't understand it here, so to speak. You know what you need to do, but it doesn't mean you want to follow with that. And so scent helps a person being put in a totally new environment, emotionally, behaviorally, and cognitively. So that's not that they're thinking about changing their behavior, they're experiencing a new behavior. And the fact that the olfaction system is so close to all these other parts that are involved in cognition and emotion makes this type of research, in my mind, one of the most fundamental research in neuroscience nowadays.
Thank you very much. And next question is, what scientist still doesn't know but would like to discover, right?
Yes. Well, it's I would say I always like to base my opinions on hardcore biology. So the more we understand how each process works, the better it is. I would say that the more we understand specifically how those receptors work, the better informed we're going to be in making prescriptive analysis on one side, but also therapy. What's the tricky thing that we're talking about people, and people are complex beings. And so I would love to tell you that we can understand everything based on patient vitals, modulating cortisol, for instance, and biology. But the truth is that people are complex because they're more or less rational beings. And so it's really hard to make any claim if you skip questionnaires and surveys. So what I would much prefer to do more factual data and have new discoveries simply focus on neuroreceptors and neurotransmission. The truth is that to really understand how it works, science will have to discover even more things about the behavioral and emotional scales. And we have plenty of scales in that sense. I don't know, the vividness olfactory imagery questionnaire, the odor awareness scale, the LMMs, which is the linear mix effect model. So we do have that. But in my field, we sometimes take those surveys, those qualitative studies with a bit of skepticism. And again, I think it's healthy because, especially when I work as a psychologist, as a psychotherapist, we know how much misinformation can occur if you just ask. In other words, people might answer those questions even freely and openly, but it doesn't necessarily reflect how their brain processes things. So if you ask me what science we should discover, it's even stronger links between the way we think and the way our brain thinks for us, so to speak.
And comparing the scent and knowledge regarding scent and how this scent impacts us, and let's say visual or more audio, it seems that some kind of obligatory research are lagging behind. Well, what could be reason for that?
I would say, in general, this applies to scientists and the general population. We don't really understand what we don't see, and we are more prone to claim that because we don't see it, it's not as important. And I want to give an example, because this is not the first time those things happen. Now, nowadays, for the last maybe 30 years, this is definitely true. What you just said is definitely true. It's kind of lagging behind. But to give an example of what happened over 100 years ago in the age of positivism, when the first research came out about the effects of bacteriological infection first, and then viral infection afterwards. The idea was this: in an environment of positivistic science, and this was especially true for the United Kingdom and to some minor extent France, The general idea was this: unless you can demonstrate empirically something, this something cannot be taken as existing, right? Now, this was the right thing to do, because prior to that, you might have argued that there were too many theoretical or philosophical constructs. And so the idea is that unless you can show me how something works, I cannot just believe that you know. But the downside of that is, until microscope technology was developed enough to show the existence of bacteria, you can understand how the British scientists thought, so you're telling me that we're getting sick because we're not washing our hands enough and there are kind of crawling beings inside of us? That doesn't make sense. It's almost saying that, I don't know, spirits are crawling inside our body. And so the Prussian scientists, so northeastern Germany at the time, had the theory, but didn't really have the technology to support a theory. And this is connected yet again to the idea that absence of evidence doesn't mean evidence of absence. So just because you don't see something, it does not mean that you can claim that it's something that does not exist. That's, I think, what is happening to olfaction nowadays. It's easier from a neuroscientific standpoint, from a standpoint of study design, to monitor other senses. I would say hearing, top of the top, possibly followed by tactile experiences. Although even those, I would say, without one of the biggest research in neuroscience on mirror neurons by Giacomo Rizzolatti in Italy in the late 90s, even without that, just because you have receptors for tactile experiences, you could not claim that those were linked to monitoring behaviors on the basis of observation and make it your own. And there was a cascade of data that was stemmed from that, but that was easier, so to speak, because at least you can see it, you can perceive it with your basic sense. With olfaction, first of all, there are two main things. The first thing is that it seems to be more subject, individual based in comparison to vision. It's not necessarily true, but for instance, if you're telling me, well, I can see, I don't know, I can see a phone here, okay? You should be able to see it too, and then we might, disagree on, the aesthetics and whatever contemporary art perspective, but you can still agree that it's a phone. With smell, it's much more complex. So this is one issue, and this other issue is that both olfaction and the sense of taste, they're kind of mutually modulated. In fact, we could say that tasting something is a subgroup of smelling something. In fact, if you just do this, you try to eat something, you will not have the same experience whatsoever. So these two main reasons: one, I would say theoretical construct study design based, and the other one based on the assumption that it's harder to study those things.
And, right, we have for hearing, we have audio recorders. For eyes, for sight, we have a photo camera. But why would humanity would need a scent camera or scent recorder?
I mean, I'm biased. I would love to see that happening as soon as possible. I would say I will admit my bias. I think it will be extremely helpful in my field. Again, neuroscience applied to therapy, for the reason that I mentioned earlier, namely that just because you know that something is good for you, it doesn't mean that you will follow up with that behavior. The practical application would be in things such as addiction, for instance, PTSD, other mood and personality disorders. So smelling something and being able to retrieve that memory based on smell via video camera or photo camera that are predicated upon scent camera, my apologies, I think will be fantastic, because yet again, we spend a lot of cognitive and behavioral time relating to smell. It's just that we are not aware of it. And so being able to go back to a piece of comfort on one side will be extremely helpful for decreasing anxiety, for instance, but also the opposite will be true. If you're working on PTSD, one of the standard practices in psychotherapy is progressive exposure with relapse prevention. So you allow a person to slowly and progressively meet the challenging thing, the triggering factor. And so, for instance, in the research we do with veterans, we use scents such as burnt flesh or gunpowder, not because we want to scare them, but because we want to progressively readapt their sense of smell to the difficult situation. So if you could have that in a form of a scent picture, I'm not even sure how to define it, you're the expert here, that will be something that can be constructed over time, with part of a psychotherapeutic trauma management program. That would be fantastic.
And let's imagine that in 2 years there is a scent camera or device for recording scent stimulus and storing and replaying. What would be the first? Scent which you would personally like to record?
Well, sorry, I missed that. What would be the first
scent or odor if you would like to record?
The first scent. Oh, that's a really interesting question. I would say probably something related to human factors, either probably sweat or breath, something that's very human-based. And the reason for that is because there's plenty of research already that indicates how much smell determines human relations. And so that would be helpful, for instance, in the context of better understanding romantic relationships on one side, including friendships, I would say, but also from the other side, understanding how to overcome trauma such as sexual abuse and rape. They're so deeply embedded in our being. So it's not a smell that I would like to have around all the time, of course, but from my scientific perspective, anything related to sweat and breath and the odor of the skin will be probably among my top 3 smells that I would like to have more information about, for sure.
Thank you very much, David.
Absolutely.